Hernandez, Public Information Officer, and with me is
Maggie Jackson with the Garfield County Health Department.
Yes, and coming to you with another monthly community health update. So we're going to kick this off real quick with something fun, festive, and I wanted to bring this to you guys. Doesn't require any buying or assembling or any material, and it's kind of taking it back old school a little bit. It is Simon Says. So you will need 3 people. So for any family gatherings that you might have with kids, to kind of bring order to a situation, especially with little ones, this is really fun and keeps them engaged and off of screens for a little bit. So you are going to need at least 3 persons to participate, and 1 person is going to be chosen to be Simon. Simon gives the command, which is going to start with Simon Says. Players only can obey the commands that start with Simon Says. And if you do obey a command that does not start with Simon Says, then you are out. And then underneath that, there's just some helpful or fun and helpful commands that you can do with your family, especially with little ones. And to kind of put a unique twist with adults and to kind of help stay a little bit fit, you can do Simon Says for adults. Jumping jacks, push-ups should make the holiday a little bit more interesting. And for our next slide, I'll kick it over to Maggie.
All right, that is such a fun idea. I have little ones, so we will definitely be playing and burn off those holiday calories too.
Yes.
We just have some other ideas for having healthy holiday gatherings, some quick tips. So first, Diana had this idea today. You know, there's a lot of stomach bugs going around lately, and when we're serving food with a larger group or our family, germs spread when we're touching each plate. So she suggested putting things in individual servings instead of those bowls full of candy or pretzels, little fingers grabbing everything. Just have them in little Dixie cups or on napkins already, so that there's not that touching of everybody grabbing the food at the same time. Another idea is that instead of a buffet where everybody could cough or sneeze on food or everybody's touching utensils, have 1 person serve. And don't make it your mama. She gets a break, she gets to go first, and you get up and you serve that buffet. And then there's only 1 person touching the food, and that person can make sure their hands are washed and not sharing, all the utensils. Also remember just some food safety tips. The easiest thing for me to share and remember is 2 hours. Anything perishable, don't leave it out for more than 2 hours. So especially that turkey, that ham, all those dips and things that we just leave out all day, just make sure you put them back in the refrigerator after 2 hours. And just make hand washing easy. I have little ones, they can't always reach the sink. Have a stool ready for those kiddos that might not normally be hanging out. Put some hand sanitizer by the front door, right in front of the food at the dining table, and make sure everybody washes their hands. That one's something we all should be doing. Covering our coughs with our elbow, all those things we do to help limit the spread of germs. Something, this year, stress and mental health, we can often feel lonely, isolated around the holidays. So if you're feeling sick and you can't gather, we suggest Zoom calling or FaceTiming. Do something to reach out to your neighbors and family who might not be able to gather or might be more vulnerable, and probably shouldn't be in a large family gathering. So you still use that technology like we've been doing all throughout the pandemic, to make sure that our friends and neighbors and family feel included. So we're back to COVID-19. We're still in COVID-19. There is a lot more testing available this year, and vaccines are available. And those are the 2 best ways that we can reassure you that your gatherings are safe. If people are vaccinated, and if they've had a COVID test, you can have peace of mind as you gather. So we were going to share a little bit about testing and how you can get a test before you gather this holiday.
So here is some helpful information to just keep in mind during the holiday. There is a plethora of testing supplies everywhere. I mean, I think you can even order some on Amazon, even home testing kits. So be aware that that supply is there and ready and available to you. So home test kits are now widely available. Isolate if you have a positive test. 10 days is the recommended time frame to isolate with a positive test. And if you are still experiencing symptoms, and get a hold of your provider, and they can advise you further from there. We recommend following a positive home test with a PCR test. Those PCR tests, they do get sent off to OSDH, and so that's how we can also monitor for the new variant. So that's just some helpful tips if you do test with that rapid test, to kind of follow up with the PCR test, and it kind of helps narrow down what variant as well.
That's right. Yes, we're seeing those home test kits are convenient, they're fast, and are fairly accurate. But if you get a positive test result, confirm it with a PCR, and you can find those at our urgent cares, hospitals, a lot of providers, and of course at the health department. This year, our staff are getting a break. Last year, there were not a lot of breaks, but we will be closed on the 23rd and 24th. But after the weekend, we'll be open again, and testing at the health department is by appointment. So come on over and we'll get you a test. Our results are taking 24 to 48 hours, or we can offer a rapid test as well. What's next? So just as you're traveling throughout the holidays, I suggest being COVID aware, just especially for our more vulnerable family members. Some areas of our state and of the country have less spread of COVID-19. So we put a link just to oklahoma.gov/COVID-19. There is an alert level for each county. You can also find this information on the CDC COVID tracker. Just even if you Google COVID in Dallas or wherever you're going to see your family, it's a good idea to know what the COVID situation is there. And the next slide, we just, we're talking about flu shots.
Yes. So something to keep in mind in your holiday to-do list after you checked off the hot chocolate, the Christmas movies, and the merriment. Don't forget to check off your flu shot. And I know it kind of gets lost in the COVID-ness part of this time, but flu shots are available at our local health department. So give us a call at 580-233-0650. We'd be happy to have you. Walk-ins are welcomed.
Yes, thank you. You know, there has been a lot of talk about how COVID-19 might be spreading in some of our communities. I did want to show you this little, if you can read it, there's a graph of our cases. So you can see those orange dots. That is around, last December when we were at our highest of our cases. But then earlier there in late September, we got pretty high again due to the Delta variant. And they've dropped off a little bit once we got to November, but you can see the last couple days we have been increasing in our cases again. This is due to people gathering in their small places indoors, and we're seeing the spread of COVID as we do every year with flu. So that respiratory illness time, it's that time of year basically. Yes. And we have had the recent news that in Oklahoma we have the Omicron variant. So we have 158 active cases here in Enid. So that, that's a lot of people still that are testing positive for COVID-19. We did detect the Omicron variant through genetic sequencing in Oklahoma. So just like other states in the U.S., we're going to be watching the increase. What we know right now, we've seen a little bit of research from other countries, but in the U.S., it's an unfolding situation. So we are seeing that this variant is more contagious, and it potentially will be less severe. So that's some good news for for this new variant, that most people will experience mild illness, but that means they could be spreading it. And that is one reason it is more contagious, because people don't know they're very ill. So those more vulnerable people are people over 65, those with chronic conditions. Those are the people that could still experience severe illness. And for everybody, if you have a COVID-19 vaccine, we recommend booster shots for everybody over 16 now with Pfizer, and the other vaccines, Moderna and Johnson & Johnson, are over 18. We're encouraging you to get your booster or get vaccinated if you haven't yet, because that vaccine is what is going to keep that new variant from being more severe. So you might test positive, you might become infected if you have a vaccine, but it decreases your likelihood of having severe illness and going to the hospital and potentially death. So if you haven't had a COVID shot yet, come on down. We walk in from most days, Monday through Friday. We just are closed this week, Thursday and Friday. I wanted to share this we could put in the comment section or on a link, just if you are looking for news on COVID-19 as this new variant spreads. If you're interested in data on epidemiology, all of our vaccine rates across the state, different factors going on, or our county risk alerts, we'll share these links in the comments so that you can find that information for yourself. If you are a researcher, like to get straight to the facts, that's where they are. So that's all we have for you today. We hope you have fun this holiday season. We've had a blast. My kids are ice skating right now, and we are just, we want everyone to enjoy their holiday, enjoy their families. Play Simon Says. That's right. Be safe, and we wish you all the best for the rest of this year, and a Happy New Year as well.
Bye, guys. Thank you.